Because here's what I'm not interested in, Josh. David, let me just say this. We're not interested in discount healthcare. All right, discount healthcare means it's a healthcare of last option, last resort. Nobody wants their parents, their child, their neighbor, their church member, colleague, coworker to go to that hospital. So we're not interested in a bargain basement, type of a healthcare system. We've got to be serious as a community and as a state capital that we're going to have quality healthcare with quality professionals. And while, we respect what Jackson Healthcare has done to this point, they are in it for the long haul for the betterment of their community. Then we got to find somebody else.
Alrighty, welcome back. Alabama Politics This Week. Josh Moon, David Person, and man, we are happy. Once again, the mayor of Montgomery has made a little bit of time for us. Mayor Stephen Reed, how are you, sir?
Hey, we're hanging in there. But overall, we're doing pretty good. I won't complain.
Good deal. Hey, I don't know if you noticed this, David, but we're way underdressed.
I do see that. I'm overdressed. Normally, we can get this thing going. I'm in my casual gear / workout gear, whatever you want to call it, active wear, I guess. But this morning we had to get in early to get some things knocked out. Now we're going to have time to change up with what we have scheduled today.
That's all right. Hey, listen, we like it. It makes us look more professional. It makes it look like we know what we're doing. You know what I mean? It really brings an air of professionalism to this podcast that we don't have without you. So we really do appreciate it. Hey, let's get right into the hard stuff. And we were going, because David and I were going to talk about this. I've written a column about it. And that's the Jackson Hospital situation that's going on in Montgomery right now. And, a bankruptcy court, which you never really see from a bankruptcy judge, the sort of pointed, highly critical order that was issued last week by the bankruptcy judge to the Jackson Hospital executives who were trying to blame Blue Cross Blue Shield for all of their problems and worries. And that kind of trickles down, I think, into what we had thought for a while about the mismanagement and some of the problems that had gone on behind the scenes there. But no matter what, you're still looking at the potential of losing a major healthcare center in the city of Montgomery. And so I guess, where do things stand right now? What are your conversations like with those executives, and can this situation be salvaged in some way?
My understanding is that there's still discussions that are going on between Blue Cross Blue Shield and Jackson Hospital. We're certainly hopeful, that they can come to a resolution where that's concerned, something that both sides can live with. But for us, in my office here in the city of Montgomery, we're obviously concerned about our residents, their health and their well-being. We're obviously concerned about the region at large, which depends on Jackson Hospital for healthcare purposes. And we're concerned about the future of healthcare moving forward throughout, central Alabama. And I think for us, that has to be, the forefront. We're not really here to pick sides. As I said before, when you serve on the bench like I have for 7 years prior to this position, you learn how to be a referee. You learn how to try to, be a good mediator and bring, people together. But you also have to be willing to make a decision yourself. And that's the difference, in this executive role. You have to be able to make those executive decisions. And the decision that, we're committed to here in the city is that we're going to support healthcare, not only in the city, but in the region, with whatever means that we can. And I think that there are some models. I think there's some examples out there that may not be perfect, but I think they're good. And I think it's going to be up to us to try to bring various sides, including Montgomery County, to the table to have those discussions around support, priorities, and how we move forward along with the state of Alabama and sort of the city government itself in this discussion.
Yeah. It's funny the way I think a lot of the information flows sometimes, out of situations like this. You know what I mean? It really is. It really, I'll tell you what you need. You need a good media source in town. But it's another discussion.
that never hurts.
Yeah. So there's some folks in there really covering things on a day-to-day basis. But besides that, it just, it really I think a situation like this, it kind of catches a lot of people off guard, and is kind of allowed to, problems are allowed to fester, unbeknownst to a lot of people, because you don't have necessarily people, the watchdogs that you've had before in the city, and that this media and a lot of folks, but it just this I mean, am I wrong? I know that Jackson was having some troubles, but this sudden, hey, we're going to run out of money June 25th, that seemed to catch a lot of people off guard.
Oh, it certainly caught me off guard.
Hmm.
You'd like to have some warning, I guess, that things are not sustainable at a level. We were told some numbers by the CEO of Jackson, but I was never given that timeline that, by, you know, June 25th, we were going to be out of money and that sort of thing. It makes you wonder if they're out of money, they just decided, hey, this model isn't working for us, right? And I understand it to some degree. I'm not a billionaire, obviously, um, but or else we'd be having this conversation from a beach somewhere right about now. I think that the Jackson Healthcare has to decide whether or not this model works for them, whether or not it is something they can see moving forward. Because here's what I'm not interested in, Josh, David. Let me just say this: we're not interested in discount healthcare. All right, discount healthcare means it's a healthcare of last option, of last resort. Nobody wants their parents, their child, their neighbor, their church member, colleague, coworker to go to that hospital. So we're not interested in a bargain basement, type of a healthcare system. We got to be serious as a community and as a state capital that we're going to have quality healthcare with quality professionals. And while we respect what Jackson Healthcare has done to this point, if they are in it for the long haul for the betterment of their community, then we got to find somebody else, and we got to figure our way through this because I'm going to be in Montgomery. Most of the people I know are going to be here, and so the decisions we make are going to impact us 5, 10 years, 20 years down the line, long after we're gone from our current office that we're in here, and we got to make the best decision for the future. And we got to be willing to have some bold conversations about this. Other communities have done it through taxes. I know that's a foul word in Alabama language when you talk about that, but you have to have some money to pay for something, or else
Hmm.
you're going to be treated, you're going to be treated as a second rate or third class community. And nobody wants that. You can't hire teachers, you can't hire doctors, nurses, you can't hire engineers, you can't hire good carpenters, whatever the profession is, if you don't have a certain level of things that people depend on. That's education, that's public safety, and that's healthcare. So we got to make sure that we're willing to have the tough discussion um, as a community, and we got to be willing to do some bold things. And Josh, unfortunately, Montgomery hasn't done very well about doing things proactively. We have
Yeah.
been too reactive. Public education was one of those things we addressed when I came in 2019, and we passed an increase in taxes uh, for education in 2020. Huntsville and Madison County had that for 35 plus years and not 40 years, and we still aren't at their level of funding, by the
Hmm.
way. So healthcare is another thing. When you look at Jefferson County and the Cooper Green model, they were doing this. It wasn't perfect, but from the 70s all the way through, and UAB has come in to kind of work with them, and it's stabilized and improved things. So
Hmm.
we've seen models from East Alabama Medical Center in Lee County. We've seen models in Houston County down in Dothan that are funded to sustain healthcare. We don't have that revenue source here, Josh, David, and we haven't had those tough discussions about what it's going to take to really do that. But now is the time that we have to make sure that we're having that discussion about how much do our own lives matter to us, to our families, our friends, our neighbors, and how much are we willing to sacrifice as a community in order to make sure there's quality healthcare options, not just for the residents of Montgomery, and I'm just the mayor of Montgomery, but for all those surrounding communities that can't get airlifted to UAB, that can't get, don't have time to make it a couple of hours down to Mobile What happens to them then? And we got to make sure that we have that option here in Montgomery. And if it's not with the current leadership, then we have to find somebody that's willing to invest with us in the long haul.
Mayor, I'm also thinking about not just the citizens of Montgomery or the region, but also those of us who travel to Montgomery for any number of reasons. And
Tri-state government.
especially, right. And especially now that you have, EJI and the Southern Poverty Law Center among those entities that are drawing literally hundreds of thousands of people there annually. I mean, for those folks as well. So it seems to me like the state itself has a vested interest in ensuring that this hospital does not fail. I mean, would you agree with that?
Listen, absolutely, and I think the state has done a pretty good job of putting up about $40 million toward capital improvements. I think there's some other things on the table that the state is willing to do that would help a healthcare provider, maybe through some incentives, maybe through some tax abatements, some other things that have been tossed around a little bit. So I think the state is willing to do some things. But again, we have to be willing to put everything on the table, from healthcare tax and occupational tax. We have to be willing to put everything on the table at this point. Even if it's something that we say, listen, maybe it sunsets after 10 years. But we have to be willing to do whatever it takes, not to save Jackson Hospital, stabilize it, and then to invest in it so that it prospers. If that's a partnership with Alabama State University, that's a partnership with the Equal Justice Initiative, it's a partnership with Tuskegee University. We have to think about whatever model works. Again, not only to keep this afloat, but to make it to give it the opportunity to move down the river, if you will. That's going to be very, very key, because that impacts not only Montgomery and the city and the residents who I represent, but it impacts the residents of Pike Road. It impacts the residents of Prattville. It impacts the residents of Wetumpka and so forth. And everybody's going to say, well, we have our own healthcare center here in Greenville and these other places. They don't have the type of care that one could get at Jackson's Peak. So we've got to make sure that we're willing to do that. And I'm not willing to concede to something that we can't get back to that level. Others are. I'm not there at that point, because, again, when you start discounting things, then what you're telling me is you're giving up hope, and you don't have any optimism for what can be. And I just have the optimism, and I have the determination to work with whoever on whatever type of deal that's needed in order to make sure that we have quality health care in Montgomery. And then I believe that we have to look at how we change things with whomever the next governor is around healthcare for this entire state. We just have to do it.
Yeah. Now, I heard you just mention a few institutions and the potential for partnerships. You mentioned EJI, Tuskegee, Alabama State. That's interesting to me. Have you actually, is somebody actually floating those as real possibilities? And if so, can you talk about those
Yeah, I'm
conversations?
floating it.
You're floating.
I'm the source.
You're floating it. Okay.
This is the float, my man. This is the
This
float.
is it. Okay.
Source, breaking news.
Okay.
Listen,
Okay.
David, when you, hey man, listen, when you in that deep end, you don't care where that life preserver comes from. You just look for a
Okay.
life preserver.
Yeah.
So we got to be willing to look at models that have worked across the country. Now I've looked at several. Several of them are public-private partnerships, what we call P3s in our space. So there's a philanthropic arm to that. There's a public entity in it, and then sometimes, of course, there's that private, for-profit entity as well. We've had other groups that have come to us probably as far back as November of 25 interested in a model of healthcare in Jackson Hospital. We're revisiting some of those conversations. And then we have looked at what's worked with other cities in other communities, some large, some mid-sized like us. And what we've seen are kind of a combination of things that have brought various entities together that otherwise could not do it by themselves, but has brought it together for the betterment of the community itself. And I think for us, you mentioned the tourism impact, certainly significant. I think about it for the residents first impact
Sure, sure.
as the mayor. And then again, one has to think about you got state government business happening here. That is business leaders from all over. That's government leaders from all over, both state, national, international. Um, we want to make sure that if something happens, if someone has a medical emergency, they feel confident in any of the hospitals they're going to, the type of care that they're going to receive. And so I think for us, we've got to be imaginative. I think for us, we've got to be bold, and we've got to make sure that we don't waste this crisis. And we've got to be sure that this is something that we aren't coming back trying to plug a hole in 18 months or 36 months. This has to be something that at least is 10 years, and if not the next 20 to 30 years that we're looking at. But I think all those entities are potential partners. I think all have strengths and bring assets that no one entity currently has right now. And there probably are some others that I haven't mentioned as well that we'll be knocking on their door and giving them a call to see what role they might be interested in playing and see what they might be open to do. But I think we've got to be creative. And I think if we are creative, we are solution oriented and not just pointing the finger at the problem, then I think we can address this issue for the long term.
Yeah, and let me just say, while I definitely understand that your first priority is the people of Montgomery, no question, I get that. I'm also thinking about how when I was down there, and of course I've been back and forth a lot since then, but when I was down there for EJI's grand opening a few years back, I'm looking around and I'm seeing, the late Reverend Jesse Jackson was there. And I'm looking at him, and he clearly, even at that point, you could start to see that his health was, he was having some health challenges. You sure as heck don't want, the headline to be, somebody like Reverend Jackson has a health crisis and can't get health care in the city where the health crisis was, and they had to take an ambulance or a med flight or whatever up to Birmingham or someplace. You
Hey,
definitely
David,
don't want that to be your story.
you don't want that, but David, I'm gonna bring it home. I don't want it for myself. I don't want it for
Yeah,
my family or friends.
right, right.
And I'll tell you this: I don't want it for a state lawmaker who I may disagree with politically,
Yeah,
but who are here all the time. And again, that's not the youngest crowd that
right,
we're gonna
right,
find
right.
out there, right?
Yeah.
Not the
Or the
same thing
healthiest.
you're having the young people, but
Yeah.
not the youngest crowd that you have there. So again, we've got to look at this from the standpoint of it is a major pillar to any city, any region's viability. And so even when it comes to jobs, and this is down the list for me, you cannot expect the economic momentum that we've had over the last several years to continue and companies to continue to look at you the same if they don't feel like their employees, their team members can get health care that is needed, much less the executives, anybody else. Um, it's going to have a detrimental effect on home building in Pike Road. It's going to have a detrimental effect on retail development in Prattville. It's going to have a detrimental effect on commercial development in Montgomery. And so all of those things kind of play into the vibrancy and the economics, and I hate to put it this way, but the economics of a city and a region. So for us, there are a lot of reasons for us to try to think through this. Not that we are reinventing the wheel, but to leverage again what we've seen around the state and what
Mm-hmm.
we've seen around the country when it comes to the type of collaborations and partnerships that have worked when it comes to struggling hospitals and healthcare. And then certainly, Josh, I think as you mentioned in your column, it's important for us to take a long range look. And I hope both gubernatorial candidates will be talking about this as they're making the stops throughout the state of Alabama about what is their plan for not just rural healthcare, but healthcare overall in our state.
Yeah, I agree with everything that you said, and and I joked earlier about the media having a media entity and stuff. But it in talking to a lot of people there, and we've look, just to be frank with everybody who's listening, and everything. Look, we're planning on doing some stuff, in with Montgomery through APR. We're planning on doing some things to help tell a better story about the city, to help tell a better story about the economic development, to help tell some truer stories about public safety and crime. Because I've been to Montgomery a lot, love it there, and I was unaware that I was in danger the entire time I was there. But it's so. I really have a lot of people, who I care about a lot, who live there. A lot of friends still, and and talked recently with Anna Buckaloo over at the chamber about some of their successes that they've had and how these things never get mentioned. And I think a lot of that, there seems to be a real problem, and I don't know a better way to describe it. I mean, almost a glee that people have in trashing the city of Montgomery. Even the people who live there seem to have this to take some joy in talking about how terrible it is, or how awful, or how scary, or dangerous, or whatever. And I think a lot of that comes from what we were talking about earlier, with the lack of anybody there telling a different story. Telling a story. I mean, there's a reason these people are coming and locating businesses in Montgomery. Okay, there's a reason they're doing that. There's a reason why people still live there all the time. It's and there are great people doing great things in that city, and I don't you don't hear about that, and then it lends itself to kind of the swoopers, is what I call them, the folks that swoop in from a media outlet somewhere and tell us a negative story about something. They swoop in and say, hey, there's 4 people got shot. 10 people got shot, 3 people died, but there's no other story about what all has happened and what's going on in that. And, let me ask you first, do you agree with me? And then second, if so, how much of a problem do you think that truly is?
Well, listen, yes, I certainly agree with you. I think perception is reality for most. And in today's world of AI and deep fakes and algorithms that dictate what you see and how people get their information, it's problematic. No question about that. The negative stories, get sent to the top of your feed, a lot more than the positive stories. And that's on top of the old adage that, bad news, runs around the world while, good news is tying the shoes. So, when you put that in the context of social media, certainly it reverberates here, regardless of what the data tells us and regardless of what people on the ground and our first responders are telling us across this city. So it is certainly a problem for us. It's something that we recognize and we realize, and I think that there are those who view it as a zero-sum game, that they have to trash Montgomery to build up their community. I don't really view it, from that perspective. I'm Team Montgomery, I'm Team Alabama, and so I don't let folks from outside the state talk about us. Without looking at it themselves first, and wherever they live, and I don't really let a lot of people outside of Montgomery talk about us without looking at themselves either. So, I think that we've got a lot of great things to share. I think probably the next time I come on, I'll have something that I can share with you, give what's in the pipeline that's even more significant. So you look at the type of economic growth that we've had. Obviously, we're doing something right. Obviously, the city of Montgomery, even Montgomery County, are doing some good things here. So, for us, I think we got to make sure people know the good news. We got to be intentional about sharing the good news. And Josh, I've said this before. I don't know if I've said it here, but when you're not used to winning, you don't know how to win. And I think Montgomery's not used to winning. And again, I've been on winning teams, many, many years ago as an athlete, been a part of many winning organizations. And certainly I can look at my campaign, I guess, maybe as a a microcosm of both, maybe in this administration. Those that won had the belief that regardless of what was going to happen, they always believed they would win. those that were losing mindsets and, always believed that regardless what was happening, they were going to lose. It
Hmm.
didn't matter if we were up, with 2 minutes left in the fourth quarter. Um, we felt like we were going to lose. If those losing teams, we could be behind 2 minutes in the fourth quarter, and those winning teams felt like we were going to win. So a lot of it is mindset, a lot of it is projection, a lot of it is confidence, and a lot of it is getting past, the what I'm gonna call kind of the microaggressions of, what somebody feels because the city doesn't look the same anymore. No, most cities don't look the same. Nashville doesn't look the same it did when I was in school there 22 years ago.
Yeah.
Uh, most communities change over time, at least you want them to, for the better. And some will focus on what's negative and what, is bad about it. Some will focus on what's positive about it. But I think for us, it's about spreading the positive news and talking about the things that were going. Let me say this, and this has nothing to do with Montgomery, but I'm going to give you an example. I told Mayor Woodfin and his team, congratulations for being #1 in that Wall Street Journal article about cities for young professionals to move to. It wasn't Oklahoma City. It wasn't Charlotte. It was Birmingham, Alabama. And I said, man, you give me something to reach for. I said, we're going to be on that list one of these days. And I said, we're on some good lists now. But that Wall Street Journal article, which I don't think last time I checked is a progressive rag, saying something
Hmm.
positive about Birmingham, Alabama. Both can be true to say in Alabama and Birmingham being the #1 city for young professionals was great. And what did I see in some of the social media comments was just pure negativity
Mm-hmm.
from people who probably don't even live in Birmingham.
Hmm.
They may work in Birmingham, but don't live there, as opposed to saying, man, I'm glad that the Wall Street Journal, a global publication of financial information by and large, that I don't care if you're in Shanghai or if you're in Mumbai, I don't care where you are, the Wall Street Journal, for a city in Alabama to be #1 was huge. And so
Yeah.
I just told him and his team, I said, man, just great job with that. And I say that now, bringing it back to Montgomery, that while we aren't at that level yet, we've had some great things happen. And if you let social media tell the story, there's nothing but, gunshots here, or there's nothing but, a homicide there. Yeah, those things happen, and they're always unfortunate. But last I checked, they happen in most cities where there are people and guns.
Yeah.
So unfortunately, we haven't fixed that, but I always welcome, ideas to reduce that. And I think that for us, we've got to make sure that we don't just harp on the negative without balancing it with the positive. And sometimes that's what happens, when it comes to the city of Montgomery. But for
Yeah.
us in our work, we continue to keep our heads down and we continue to try to make sure things are better for the residents we have, the residents we want to keep. We don't want to keep all of them.
Right.
Uh, and those that we want to bring here. All right.
Yeah, yeah. It's you're right, and listen, I don't want anybody to think that there's some delusion on either of our parts about what's taking place. There's a reality here, but the reality can be recognized while also not discouraging the people who are doing good work, who are trying to do good things, because that's what you're going to do. You keep doing this, and you keep harping on people. And look, I know a lot of it, especially with the politicians and folks who fly in there, but they want to, that it's a political advantage to tear down a Democratic-run city, especially one with a black mayor. I mean, look at all this crime under the black mayor because, God knows it wouldn't happen under Todd Strange, right? But
None of that ever happened. There was
yeah,
no
no,
crime. No crime.
listen, we're out on the corner sharing popsicles with each other during Todd Strange's tenure every night.
Right.
It just. I think that's the biggest takeaway to me. But is that there are problems just like with every city, but there are good people doing good things and trying their asses off to get better. Just working and trying to do better. And somebody needs to recognize those folks and let them know that they're appreciated. And because you're never going to get better. I mean, if you just sit there and talk about it on social media, it's just never going to get better. But Mayor, thank you so much for coming on, spending some more time with us and breaking down the Jackson Hospital situation. And we're going to stay on it. I've been inundated, as you might imagine, with people who know the inside story of Jackson Hospital and what's happened there, and so we're going to keep working on it and seeing what we can do on our end as well. So, but thank you so much for the time.
Hey, thanks to you and David, and just know that we're going to find a solution here. Again, I'm optimistic about it, and I believe that we have enough smart people in the community and throughout the state to help us with that. And we are going to settle again for bargain basement healthcare. We're gonna stabilize this thing with the current group that's there. We're gonna find somebody else that wants to be here and that wants to provide quality healthcare to the city of Montgomery, to Central Alabama, and anybody else that may need it. So we're gonna continue to do the work, and we're gonna find the partners to help us get it done.
All right, thank you. That is Mayor Stephen Reed, Mayor of Montgomery. Thank you so much, sir.
All right, thanks, guys. Take
Always
care.
good to see you, Mayor. All right.
Likewise.
All right, we're going to slide out. We'll come back in just a minute. It's Alabama Politics This Week. We're back in a moment.